Let's talk about restoring compromised teeth, teeth that have a large amount of the coronal part of the tooth missing with a post and core. Now, some dentists have the total misconception that a post and core strengthens a tooth. No, a post and core actually weakens the tooth because you're removing tooth structure inside the root canal, the canal of the tooth. The only reason you place a post and core is if you have coronal deficiency. You don't have a very long tooth, or you have a large portion of the coronal part of the tooth missing, and you need retention from within the tooth, in the root canal. That's the only reason you use a post. But never put a post in it. Sometimes I'll see these stupid posts in a tooth that you've got plenty of crown, and a dentist has just stuck a post in the canal. Why? Why? It does not strengthen the tooth. So this is a very complex case. I've done sinus lifts, bone grafts, implants, but the cuspid had decay under an old crown. A lot of the coronal part of the tooth was missing, and so I'm going to do a post, core, and crown on that tooth. So here's the root canal that I'd done previously, years and years ago. And so the tooth had broken down. I'm removing the decay with a slow speed handpiece. You can see when I get through, a lot of the coronal part of the tooth is missing. I'm checking it to be sure all the decay is removed, and then I'm wiping it. Now I like to wipe it with isopropyl alcohol on a cotton ball. And once I've finished cleaning all the decay out, I'll put 2x2s in the mouth to block the mouth, and I'll put isopropyl alcohol on a large cotton ball and just stick it in that area. Go check a hygiene patient and leave it there just to be sure everything is clean and bacteria is dead and all that. So I really swab it with isopropyl alcohol. So this is after I've cleaned everything away, and this is Radiosurge. Now I don't get real aggressive with Radiosurge, but it is handy if you've just got some tissue flapped over the margin. This is just a straight wire on the Radiosurge. Then I'm going to come back and put a chamfer margin on the tooth, trying to preserve as much tooth as I can, rounding this edge just a bit, and I'm about 1 millimeter subgingival. I want to be sure I don't invade the biologic width. It means you don't want to go into the junctional epithelium. You can be in the sulcus, but don't invade the biologic width, and you want to be especially careful of that interproximal and on the palatal. Round all the line angles. Now I'm going to place my post, and I'm measuring with my application on my computer the length of that root. You can see it's about 11 millimeters. That's what I've got to work with. So I like the Parapost system. I've used that for many years. It's very simple, and then I mark my length with a endodontic stop, because you don't want to drill out the end of the tooth. So I had about 12 millimeters to work with. I'm going to put my stop at 10. Now I may not get to 10 because it may be a curved canal, and it may get real thin down at the bottom of the root. So what I'm doing is as I go into that root, I'll remove this Parapost drill, rinse out the inner part of the canal very well, and then look in there with my light and mirror to be sure I'm still going into gutta percha. You want to be sure the drill does not get offline and go into tooth. You can see we're about 10 millimeters here. So this is the beginning, and I'm coming back. I see I can go a little bit further. Take that radiograph. See, this is about right. It's starting to get thin down here, and I don't want to take a chance of perforation. So this is about 2/3 the length of the root, which is about perfect. If you make it too short, you have more of a chance of root fracture. And that is the big problem with a tooth that's had endo and a post and core. If the person lived long enough, there's a good chance that what happened to my cuspid tooth will happen to this tooth, and that is that they'll fracture it right here at the bottom of the post. But hopefully she'll get 10, 20 years out of this, and it's a lot less involved than removing the tooth and placing an implant. So post and core is a very good procedure, but you want to caution the patient not to bite real hard things on that tooth. Okay, so I'm cleaning it out real well at that depth, then irrigating, and then this is a Parapost. It's just a little plastic post the size of the drill that fits into the tooth so you can take an impression. See, and that fits to the bottom of the post hole. Then I'm going to remove that. That's the length of the drill, and cut those at that length. And this is a Bunsen burner, and what I'm using is a wax spatula and just flattening the tops of these posts. I'm going to take 2 impressions, then I'm just, with the heat, just making some little divots in the side of the post for retention. So see, I'm putting a little hat on the top of the post and then just making some divots in the side of the post for retention when I take the impression. Now this is, somebody's probably already figured this out. I'm not sure if I thought this up or somebody else thought this up, and I read about it. But what I'm using is a paper clip as a temporary post while we're waiting for the final post and core to be fabricated. So I've got different size paper clips, alcohol them off real well, and then stick them in the tooth and then mark it with a magic marker. And then this is just a disc. I'm cutting that part off, and then I'm going to cut some little retention areas in the paper clip in the coronal part, not in the root part, because I want it to come out of the root. I want my bisacrylate to adhere to the part that's coronal to the canal. I don't cut these divots. Do not cut those divots in the part in the canal, because you want it to come out when the crown is returned. So you can see the little divots in the coronal part of that post. So I'm going to fill my matrix with bisacrylate, and I wet the tooth real well. Wet it in the canal and wet the tooth real well. Then I'm going to squirt the bisacrylate, this is Lexatemp, around the tooth and a little bit into the orifice, and then I'm going to put my paper clip to place. Then I'm putting my matrix to place. Let that set, remove it. See, here's my paper clip in my provisional crown. Trim that, just an acrylic burr. See, now I don't squirt that bisacrylate way up into the post. I just let the paper clip take it into the orifice, into that hole as far as it wants to go. But see, it's not very far up the paper clip. I don't want to have issues with that bisacrylate being stuck in the hole. Now what I'm doing is taking an impression of the tooth, and I'm placing the parapost that I'd fabricated before, the little plastic shims that I'd put the hat on and the divots in the hole. I wet the tooth real well first, then I place this in the canal. Now I'm squirting reversible hydrocolloid around the post and the tooth and placing reversible hydrocolloid to place. You can use polyether with custom tray. See, this took a beautiful impression of the tooth and the hole. So you've got to put that parapost in the hole to capture the size and shape of the hole. Now I'm cementing this provisional restoration with Olympian temporary cement. This is really good temporary cement. I don't have any tie to that company, but it's good temporary cement. Vaseline your restoration. Don't Vaseline the paper clip, but Vaseline the restoration, then squirt this Olympian provisional cement into this part of the provisional and push it to place. You don't want to squirt it down into the hole. Just push that to place, let the provisional cement set, take a shade, send it to the laboratory. Now the post and core and crown have returned. Now remove the provisional from the tooth, wipe it with isopropyl alcohol, scrub it real well with a 2x2 in the mouth. This is right after we've removed it. See, the tissue looks healthy. I'm trying the post and core and the crown to place. Now, it's a metal post. They're preformed zirconium posts, and I've tried those. I personally like a metal post connected to the core. Sometimes the post and the core and the crown are all connected, but I just prefer a metal post. They work for me, they're strong. You'll hear people say, well, but that's just like cementing a nail. Well, cut these little tiny divots, just little thin divots in the post for retention grooves, just little not deep at all. And then wipe it real well with isopropyl alcohol, blow that dry, clean the crown, and what I'm going to do is I'm going to seat that post and core, and then while that cement's setting, I'm going to seat the crown. I'm not going to seat them separately. You can have the crown connected to the post and core, but I'm putting Vaseline all over the crown, but I'm not putting Vaseline on the post and core, just on the crown, the interproximal area. Now, what I've done here is taken some paper points and put isopropyl alcohol on a large paper point, and I'm just scrubbing the inside of the canal with that paper point with isopropyl alcohol, up and down, up and down, up and down, and then rinsing it out real well. Then this is Unicem composite cement, and you don't fill the crown up. Remember, the core is going to go, the crown is going to go onto the core, so you don't want to you never want to fill a crown completely up when you're cementing a crown. Just put the cement around the edges and it'll go up around the tooth and up into the crown, but you won't have an over volume of material, and so it won't prevent the crown from seating. And then I'm going to squirt it into the canal, and then I'm going to squirt the cement onto the post. And I'm going to move that up and down to be sure I've got cement. I'm going to push that hard to place. Now that hasn't set, and while it's setting, I'm going to put my crown to place. It just eliminates problems if you do that all together. Then you're going to remove the excess cement after it's set. Remember, never remove excess cement until it has initial set. If you do remove it too quick, you'll have a void in the microgap between the crown and the tooth. That can collect bacteria and you can get decay, irritated gums. So you always want to chip the excess cement off. Then I'm going to check the occlusion. Here it is seated. We've got our two implants that we're allowing to osseointegrate. There's the crown. See how healthy that gingival tissue is. So here's our crown. We did sinus lifts, bone grafting, and crowns on these teeth, which is another video. Here's the crown. These are the sinus lifts, bone graft, implants, restorations on the posterior teeth. See how healthy that looks? Just light occlusion, but I do want that tooth to occlude because it's a cuspid, but I don't want a CRCO slide. And that's the Dental Minute.
By signing up for dentistrymasterclasses.com, you get incredible comprehensive cases not seen in Dental Minute videos. You get an organized library of all the Dental Minute videos, plus these incredible comprehensive cases found only at dentistrymasterclasses.com for your reference and study. And you get before and after pictures of Dr. Cutbirth's fully restored cases. Guess what? You're not gonna believe it. I don't even know if I should tell you. Okay, I'll tell you. It's only $15 a month for this entire deal. This package deal of all of these comprehensive cases for your use, for your study, to take your practice to the next level, $15 a month. You're not going to want to miss this deal, so sign up today at dentistrymasterclasses.com.